Awesome. All right. Thank you. Thank you. Okay. So I am Daniel, President. I am joined by Secretary Robert, Treasurer Sarah, PR Chair Genevieve, and our event coordinator David. Our VP will be joining us very shortly. But thank you all for being here. We have a special guest speaker, AC Ardran Carr, and we're lucky to have him. So without further ado, oh, I should mention how this is gonna work. We'll do one question at a time, one question on each slide. There's also a document that's been provided in the chat by our Secretary Robert. If you guys have any questions throughout, feel free to drop those in the chat or unmute yourselves as well. That's fine too. So without further ado, I'll pass it on to AC. AC.
How's it going, y'all? I appreciate y'all having me. My name is Ardran Carr, like Daniel said, and I'm athletic counselor at University of Michigan currently. I am a sports performance consultant, and I'm also a mental health therapist. Some current areas of interest that I have right now are holistic athlete care, athlete transitions, faith-based athlete care, and also diversity and culture. So I've seen a lot of familiar faces here from the diversity conference that was held on Long Beach State's campus. So thank y'all for having me back, and I'm here to share some good information for y'all, and also just some real world, real life experiences from the inside. And also, yeah, he put it down on the slide. Also, I do work with a lot of injured athletes because I was an injured athlete. For a lot of people that don't know, I was a track and field athlete. I ran at Texas Tech University for 5.5 years, and COVID-19 ended my senior season. And I was getting my master's degree in clinical mental health counseling while also competing at a high level. So, and also I'm well trained in eating disorders, and I also help with team cohesion and mental performance and preparation. So Daniel, if we could switch off to my, okay, cool, 100% screen share with y'all. If you can give me the ability to screen share, okay, there we go. All right, can y'all see my screen? There we go. Let me scoot this over real quick. Okay, who am I? So yes, I am a mental health therapist, currently listed as a limited licensed professional counselor. It's equivalent to LPCA for those of y'all that are in the clinical world or are familiar with clinical licenses. This came with my degree from having a clinical mental health counselor license or master's degree from Texas Tech University. I will be fully licensed in the month of January, and basically that means I can just handle my own. I won't have to have a supervisor. And I'm also a licensed chemical dependency counselor intern. Pretty much this has versed me and helped me become more like, comfortable with handling cases with people that need like AOD assessments that work with alcohol and drugs. Um, and I also have a CMPC in progress. All I gotta do is take the exam. That's the only thing that's missing right now. Complete all the coursework. Just been really busy with work, so I just need to sit down, study for the exam, pass it. Um, go forward a little bit. Oh, sorry. Okay, so let's do an activity real quick. So I would like to hear from y'all. What is y'all's why? I think it's really important, especially in this field of work, to have a why. Kind of like we do with our athletes when we're seeing them. I think it's really important to have a focus area and a focal point of why you're doing what you're doing. That way, it can kind of give you a better direction of what population you want to work with, and also like specific skills that you want to implement into the space. So just take about 30 seconds, 1 minute, or if somebody already knows what their why is, go ahead and unmute and share or type in the chat, whatever you got to do.
So I think my why is it's pretty broad, but it comes to mind pretty easily. I just know I want to help people. I mean, some way, shape, form. It's like I think I want to, and I think I can. So I think that's essentially my whole why.
Good. Trying to get back to the community, just help people, make people have better lives, right? Can I hear from like two more people?
Our PR chair in the chat says giving people resources I wish that I had when I was a young student and athlete.
That's my why. Yeah, being able to give people the skills and to help the next generation. I think that's so important because if you look at, our field is growing day by day, year by year. you kind of just want to be able to be part of that growth for all my people that are out there that are trailblazers.
I think my why is I don't think it's changed because I kind of checked myself like a couple of months ago. Am I still in this? The same reason I would, after everything that we've been through, I feel like it's healthy to do that. Kind of like, okay, what's going on here? What am I going to do? Especially like, we're graduating in May, and I think that's even getting more important for me. It's like, okay, what exactly you want to do? And I think it's pretty still solid. But the reason I got into this was because being an athlete and being a performer on stage, the stresses that go with that are really difficult and to handle. Also, what I've seen and know now as being in this program is that that only 1% of athletes really make it into the professional world. And I really have a passion now to actually help athletes and performers to find their identity outside of sports and be more holistic and well grounded in life. So I think that's
So
where I'm at right now.
that's really good. I think it's really important to know what your why is as a professional and as a clinician, as a consultant, because what it's going to do is it's going to allow you to really practice in your scope of what you want to do. I know mine was athlete transitions and also injury support. And kind of like what you said, Phil, just being able to align yourself with some of your own experiences. That way you can help those people that have shared experiences. Okay, cool. Okay, so this is like a little bit of my career trajectory and kind of like how I built my foundation. There's so many different approaches to how to get in this space. There's no correct way right now. Y'all still got to remember this field is still very new and it's becoming very very trendy. So a lot of people are kind of I've seen people literally like become like nurses and then they become really interested in what we do and then they get their CMPC. I've seen like MDs. I've seen lawyers. People are hiring performance coaches for their law firms. So the field is really kind of just all over the place right now. So you kind of have to find your lane specifically, and I think that's why it's important to have your why and kind of just choose what direction you want to go in and kind of just run with it. So I started out as a student athlete at Texas Tech, and then I got my bachelor's in psychology, which I'm sure most of us have a bachelor's in psychology. Because yeah, I think everything that we do in our field, the foundational principles are created from psychology, no matter what route you take. And then I got my master's in clinical mental health counseling, so I took the counselor route. My school did not have any like sport and exercise performance degrees or any type of like kinesiology masters that focused on like sport psychology, kind of like what y'all have. So I had to take like a counselor route. I didn't want to do it, but it's kind of like what I had, and I also wanted to make sure I lived out my scholarship and got some of the school paid for. So with me really wanting to have a heavy emphasis on mental performance work and also having that sport background because me being a student athlete wasn't enough in the job hiring process. I applied for an internship with the United States Military Academy at West Point, and then I got hired. So for those of y'all that are looking, they usually post an internship in the month of March. If you look on LinkedIn, and if you have any questions on like who to talk to for that specifically, I do have the point of contact if you're really interested in that internship. It was very phenomenal for those of y'all that want to know. You get to work with cadets, you get to work with colonels, you get to work with like literally the people that serve our country. And the mental performance model, a lot of people don't know, like the model that we follow and some of the education that y'all are being taught in y'all's courses literally was researched and applied at the military academy. And I didn't know that before I got there, but that's kind of like the origins of like performance psychology because it's very tactical and all the research out there is pretty much ran on military. And then from West Point, I started applying for jobs. I wanted to work at West Point full time because I'm telling you that experience was definitely like something very very key and pivotal in my career. As I got like to, be close to face to face and like see how people function day to day in a military standpoint. But however, positions weren't open, so I had to do what was best for myself. I couldn't live in New York, getting paid intern money because New York is very expensive. So I applied for the job at University of Michigan, and I got the job to be an athletic counselor. And for those of y'all that it's kind of different being a counselor from a performance consultant, or is viewed upon as different. But however, I kind of view things kind of the same. but it's not like necessarily exactly the same. But I'll talk a little bit more about that in another slide. Daniel, did you want to switch over back to y'all's PowerPoint to ask a question real quick before I hop into another segment?
Yeah, can you maybe switch it back to Sarah for a second?
I got you.
Okay, thank you.
There we go.
So you
Okay,
might
cool. There you
be
go.
touching on this already in your next slide, but maybe we can get started with the question. How
Yeah.
many what is your educational background, your licenses, and your credentials? Can you switch over to the next slide?
Yeah.
Yeah. How may you see the advantages or disadvantage of your background in the sports psychology field? So you mentioned that your master's was in clinical mental health.
Mhm.
So how do you feel like maybe that's helped you, or maybe it's been working against you in sports psychology?
Yeah. So one thing I didn't mention was that before I got the internship at West Point, I applied to like 3 other internships, like one at like IMG, another one with Chicago Blackhawks, and also another one with the Arizona Diamondbacks. And the limitation and disadvantage that I saw with me being a mental health therapist first was that they didn't like the people that were hiring did not see me as a performance consultant. They saw me as a therapist. That they thought that I could only handle clinical cases. However, at that time, all I knew was clinical, like how to handle like eating disorders, like suicide ideation, like schizophrenia. But just being like a new, fresh out of college, like grad student, you want to learn like how to do like performance psychology work and implement mental skills. So I feel like I was at a disadvantage, and it was kind of unfair in the hiring process because people were like, "Oh, I have a master's in kinesiology and sport and psychology," and they pretty much will exit out my application immediately because I was a counselor first. So that was kind of a disadvantage, and that's still a disadvantage to this day. A lot of counselors can't bleed over into performance, and then also a lot of performance people can't bleed over into counseling. So a lot of people are kind of pointing the finger at the Applied Association of Sports Psychology right now to kind of choose a direction on where they want to go with things because a lot of jobs will be like, oh, we're hiring like a mental wellness director or assistant director. However, you got to have a clinical license and a CMPC together. So it's kind of confusing right now. I will say the field is very confusing. And when I was at the Ask conference, a lot of people were asking me questions on like where are we even going with this whole entire thing? And I was like, I don't know. I would love to talk to the higher ups and try to figure this out because it's very difficult. So those are some of the advantages and disadvantages I have been seeing. But however, a big advantage is that there is a job for you out there and there's somebody that needs you. So don't think that this is the end all be all and there's no hope out there. Somebody's going to hire you, whether it be a law firm or whether it be, I've seen Lego was hiring. I don't know if y'all saw that on LinkedIn earlier, but Lego was hiring like a mental performance specialist. And so at the end of the day, we're all going to get jobs. Everybody in this chat, don't like, go ahead and take that out of your mind. You're going to get hired. We literally just went through the COVID-19 pandemic. Like we're on the brinks of a mental health crisis as a nation. Like you're gonna get a job. Don't worry about that. Just yeah. Next slide. Next. Okay.
AC, if you like, you can either go with this question or go back on your slides if you like.
Yeah, I'll go with this question right before I go back to my slides. So yeah, I was on a panel at the Ask conference, and I pretty much spoke on like men's mental health, like especially like men of color that work in high performance domains. For a lot of people that don't know, there's only like maybe 4% of African Americans that work in this space, and well, actually not even in this space, just in general of mental health. And then for men, it gets lower. It gets to like 2%. And then if you think about Black men, or yeah, African American men, there's only 2% that work in the sport and psychology space. And then if you think about like therapists or mental performance consultants, it gets even lower. So we spoke on kind of like the anti-racist practices and how to kind of like blend like the intersectionality of hiring more people that kind of look like the athletes that they're serving, because I think that's really important to kind of have familiar faces and like shared experiences, especially when people are in higher positions that don't look like us. And but we pretty much talked on that for about an hour, and we had an open discussion and a good panel. And next year we're going to bring it back and do like a 2-day webinar, trying to just teach people just different ways to kind of implement our practices and people, hiring people that look like me to deliver services. So okay, we
Thank
can
you.
switch back again. Yeah, for sure. Does anybody have any other questions specifically from the chat before I get back? Okay, cool. Let me get back. Cool. Get back to it. Um, so this is kind of the team that I work with. A lot of people think it's just me by myself, but I work amongst a very robust interdisciplinary team. Um, I won't say that we're the gold standard because there are other schools that I will say are the gold standard. Like there's like LSU and like Louisville. They have some really good staff. Tennessee. But this is kind of what an integrative care team should look like. We have licensed social workers that are specialized in like CBT. We have like fellows on the staff. We have a CMPC on the staff, which will be me too. It'll be two CMPCs. So we're all licensed, and we can pretty much carry the whole spectrum. I'm a big believer and a firm believer in like holistic athlete care. So I think it's really important to see the athlete as a person, but also be able to offer all the resources possible. So this is kind of like what me and my team look like, and I think ultimately this is what most programs need to try to reach and strive for, is to have multiple people that can handle a lot of different cases and a lot of different tasks. So this is kind of like what the spectrum of care looks like, that of the skill of the resources that I offer. So I try to meet people where they are as they come in daily. I work from a wellness model, and my door is always open. And I try to destigmatize, like, hey, like don't come in whenever everything is like at mental illness. Like you want to come in whenever you're natural functioning, whenever you feel a reaction, or whether you feel an injury. These are kind of like the different layers to the services that we offer as a team. Also, emotional health versus performance optimization. And we're trying to be available and let people know, like, hey, like my door's open. If you have a big accomplishment you want to talk about, or if you just want to come in and come up with like mental strategies to prevent getting to mental illness. So I think it's really important, whenever you're consulting or meeting with athletes, let them know, like, we're here for you regardless. Like, we don't want to be here when the storm comes, because that can make our jobs a lot harder. So I'm always emphasizing, like, hey, like the guy that scored 35 points last night, like cool, he scored 35 points. Like, if you want to celebrate, like my door's open, let's talk about it. And then while we're talking about your 35 points, we can talk about how you're able to kind of like, dysregulate stress at the free throw line under pressure, or how you're able to kind of like maintain that green light phase instead of getting to the red light or yellow light. So I think it's really important to kind of look at the spectrum and try to decipher the difference between the four of illness, injury, reaction, and also health. And this is the mental performance model that I kind of look at and kind of go by. So we have the reactive versus the proactive. I'm pretty sure some of y'all have seen this before. Like I said, again, emphasizing, like, showing athletes, like, hey, we don't want you in the panic phase. But if you are in the panic phase, cool, but it's gonna be deeper work. Letting them know that when you're in the zone and playing consistently at a high level, that's optimal performance. Or when you feel the struggling phase, some good performance, you have some good performances here and there. This is a good time to come in and we implement middle skills, and also allow you to kind of grow as a person. So just looking at reactive versus proactive, panic versus in the zone, and kind of everything that fits in between. And then here's some important data that I think is important to kind of look at, especially for the people that are going to be like early career professionals, or just as a student in general, and just from population matters. 63% of the Michigan student athletes reported that emotional or mental health issues affected their athletic performance in the last month. This increased to 72% in 2019. And this study was actually ran at Michigan on the campus through our Athletes Connected group. And then, of course, like 15% of the NCAA athletes will experience psychological issues that warrant counseling. This 2% is higher than non-athletes, which is important information to look at. And then also 1.5 to 2 times of student athletes reported that mental exhaustion, anxiety, and depression has contributed higher prior to the COVID-19 pandemic. So telling you, like, they're always going to hire us. We're never not going to have jobs available. And then up to 35% of elite athletes suffer from mental health crisis at one point in their career. And then 60% of college students meet the criteria for at least one mental health problem in academic year. So, and I want a lot of people to look at this and not view it as like a numbers game, because at the end of the day, you can look at these numbers and say, wow, this is like very interesting. But at the same time, if you're like, when you actually get into the space and you see people kind of like hiding these feelings and hiding these thoughts, but it's your job as a professional to kind of break that glass and let them know that, hey, like, we're here to just have general conversation, kick back. And sometimes you have to, take an alternate approach. Sometimes you have to meet people at practice and like pull them to the side and say good job, and then you never know, your good job could go a long way. And they're like, oh wow, that person is always at practice saying good job to me. I wonder what they do. And then they stop in your office, and next thing you know, they're in your caseload, and that's your client now. So think about that, just how you approach therapy and just in general, just like consulting. And then I'm gonna do this slide, and then we can switch over again, Daniel. So one thing I heavily emphasize on the campus is that mental health is not mental illness. I'm sure a lot of y'all know that, but just deciphering the difference between the two, because a lot of people, you you walk into a space with student athletes, and it's like, how's your mental health? And then they automatically think about mental illness. So we've coined the term mental fitness on our campus. We totally stopped using mental health. We kind of ask people like, how's your mental fitness? Because we like to use it from a standpoint of thinking of like, is your mind in shape? Are you out of shape? Are you having a bad day? Are you having a good day? Or are you having a mediocre day? It's kind of like your body, your physiological response. Like, because athletes are competing at a high level. Sometimes their fitness level physically is not there. However, their mindset is still similar to the physiological response. So we try to keep that mind, body, spirit coin term on our campus, just like using mental fitness to kind of destigmatize the whole like, oh, I'm going to counseling, or oh, I'm talking to like a mental health professional. Like, no, we're just regular people. We just want to help you. So mental fitness is a good term for those of y'all that are looking to kind of help the athletes feel more comfortable and be destigmatized in the space and just be themselves. And then I got some pictures on here that says mental health is a part of, not apart from athlete health. Mental health exists on a continuum, and the continuum is like being mentally well. And then mental health is a state of well-being in which people can realize their own potential, cope with normal stresses of life, work productivity, and also be fruitfully and able to contribute in the community. And then the last slide, it says mental health involves effective functioning in daily activities, resulting in productive activities, healthy relationships, and ability to adapt and cope. Okay, let's switch back. Okay, I switched it back. How's it going, Jeremy?
Good, bro. Good to see you. Thank you so much for coming on.
For sure. No, I appreciate y'all. How do you help student athletes? Oh, okay.
All right, AC. So you touched on it a little bit, right? You touched on it a lot, actually. So I guess I'll just ask it again. How do you help student athletes in your role as athletic counselor, and what does a busy day look like?
Yeah, pretty much I offer my services from literally like eating disorders, general anxiety, clinical depression, all the way from like, mental performance blocks, establishing pre-performance routines, goal setting. That's pretty much how I kind of assess my clients. I take like, I meet the biggest thing that I was taught, growing up and just in general in my master's program was to meet people where they are as they come in. Because one day somebody could come in and say, hey, like I had a tough game yesterday. I had a mental performance block and I wasn't able to score under pressure. And then the next day they'll literally come in like a week later and say, hey, me and my girlfriend broke up. Now I'm like clinically depressed and I can't perform at a high level. So it kind of goes from like, okay, he came in for a performance reason, but now it's more of a clinical reason because he can't even eat right anymore and he can't sleep anymore. So you got to kind of think about how you're assessing these athletes and how you're kind of meeting them where they are each week. And you can bring up like, hey, what happened last week? When you didn't perform under pressure, but you want to focus on like what they bring to you on the table that day specifically. So that's kind of how I assess my clients. And a day to day just looks like I pretty much see about 4 to 5 people a day. And then of course I do documentation, take notes, and then I'll try to go to practice as much as I can because it just helps the athlete, feel more comfortable knowing that counseling is not something scary, or consulting is not something scary. It's not something you just get into a room and just sit down and talk to somebody under like a nice light. I can go to practice. I can dap you up, say good job to you at practice, and get hype whenever you dunk the basketball or score a touchdown. I will say the biggest asset to the things that we do, and the biggest asset is going to be being available, just showing your face. Like I had one athlete, he literally he got like an academic award, and like nobody shows up to like the academic events. And I just came on my own time, just like, okay, I got 1 hour, I'm gonna show up and support him. He's like, man, you're here, supporting me. Like, yeah, like you know, I'm a holistic therapist. I'm gonna support you at any part of life, like whether it be sport related or just life related, because I feel like mental skills is not only just for sports, it's life skills too. It's not just sports only. So, and I preach that to my clients daily. So sure.
Yeah, no, it's funny you say that. I just had this conversation yesterday actually, and the reason why I like this field so much is that it looks at so much about the person, right? It's like it takes
Right.
it has the ability to like really look at all of the person, which I think is just incredible. But thank you, AC for that. We'll move on to the next question. What kind of past
Mm.
job or internship experiences have contributed to your knowledge? How may these experiences be similar or different? So, what are some times in your, your career where that's really stuck to you and that's kept with you?
Yeah, I mean, the biggest internship that I had to this day was definitely working with the United States Military Academy at West Point at the Center of Enhanced Performance. That's just like a different space. Like, if for those of y'all that are very interested in tactical populations, I feel like that's the most demanding and the most like literally experience you get from an internship, because most of the internships that you see for performance are very applied. Like you'll be in the field, you'll be part of like group therapy sessions, you'll be part of like you know, team building, you'll go to games. But I feel like when you see the military population, it's very interesting because a lot of the stuff is like, you know, secretive to the government. You have to like check in with through 3 levels of security every day, and it's almost like some people that you work with are kind of like zombies. Like you'll literally see somebody come in, and then they'll just be like spaced out. Like you'll be talking to them, but they're thinking about like how they have to, like, you know, pass this like fitness exam in order to graduate. That way they can serve their country the best way that they can. And when we talk about like mental conditioning, and you know how we talk about like athlete identity, and like how athletes kind of identify themselves with their sport. With the military population, it's a lot different because it's like they're identifying themselves with whatever branch of the, like, you know, military they are, like whether it be Air Force, Army, Navy, but they're also like mentally conditioned in a way to like just respond on command. Like if I told a cadet to like, oh, the best way you can mentally get over a mental block is to go jump in the water and go swim until you exhaust yourself. They would like literally do it. So you almost have to be careful as a practitioner on what you tell them to do, especially if they're conditioned that way to just go like yes sir, no sir. So I will say West Point was a pivotal moment in my life, seeing that different like performance population from the counselor space, because counseling is like a lot different from doing that performance work at West Point. And I think ultimately just having that counselor background, I can build relationships a little bit better than some of my other colleagues, because they didn't have that experience like building a relationship. And I think that's the biggest point that everybody needs to take home from this. Also, is that the people you work with, they're not robots. You know, ask them questions like, "How's your family doing? You know, when's your birthday?" Like, just get to know them as a person and really grow with them. Sometimes people say you're not supposed to be friends with your clients, but you almost need to treat it like a friendship in a way. And one piece of advice that I was told is that the therapy space and also like a one-on-one consulting space is the most intimate somebody will ever be with you besides being in a relationship. And when I say intimacy, you know, I mean by verbal intimacy. Like that's the most open somebody's ever gonna, you know, put all of their life on you and transparently and verbalize information to you besides like who they're dating or who they're gonna marry. So think about that too, how you're receiving information and also how you're gonna guide that person to where they want to be.
Thank you, AC. Thank you. Appreciate
For
that.
sure.
Uh,
Let's switch back.
okay.
Okay, so this is really important. Oh wait, can't see my screen? Wait, I was not screen sharing, sorry. There we go. Okay, so this is really important. I know Daniel specifically asked about this. I call this the Trinity. For all my Bible scholars out there, this is the Trinity of sports performance, exercise performance. So you have your psychiatrists, you have your mental health providers, and you have your sports performance consultants. A lot of people don't know the difference between the three. However, I was able to pull this information from a colleague or a friend of mine. Her name is Dr. Kinsa Gunter. She works for the NBA, and the NBA actually just released this article literally literally like 2 weeks ago, because a lot of people were demanding like, what is the difference between the three? Like, I don't know, like which way I want to choose, which career path I want to go. So it's really important for us to kind of touch on these three real quick. So mental health providers, that's kind of like where I fall at. So we have mental health expertise. We understand thoughts, feelings, and behaviors, and we build relationships between them. We work across a continuum. And then it's counseling, holistic self-care, and diagnosing and treating mental health conditions. And also we work with team organizational dynamics, cohesion and culture, and crisis management and support. That's kind of like some of the crisis management I was talking about, like suicide ideation and also eating disorders. And then mental performance consultants, which, I can touch on that too because of my training. A lot of us in the chat definitely are definitely striving to achieve and become that, whether it be CMPC or some of y'all are already practicing that right now under internship. So it's expertise in mental skills training and strategies for performance, trained and applied for psychology and sports science, performance optimization, team organizational dynamics, cohesion, culture, and development. And so there's a bleed over. So we did talk about the bleed over, right? Between doctors, mental health providers, and also performance consultants, because we all work together under the branch of psychology and just ultimately holistic athlete care. So the bleed over is proactive mental wellness and self-care practices, education about the connection between performance and development and skill building, mental health, mental wellness skills, strategies, coping and performance, and also coping skills, life skills, stress management, and also referrals. And then I'll go a little bit deeper into this. For those of y'all that need this information, I can send y'all the article. Just feel free to ask. And so here's kind of it sectioned off into columns. So as a mental health provider, I can do testing and assessment. However, I think this was kind of like flawed a little bit because mental performance consultants can do assessment and testing also, but I think it was more so from a personality and cognitive evidence-based testing and assessment, because I have seen some performance assessments like the ACSI and then also like the AIQ. But there's a bunch out there. So, but I think a lot of it was more so from like evidence-based research when they made this decision. And psychologists are not the only people that can administer testing. So I can too with my license as a counselor. So crisis management and intervention, this is kind of like the difference. So if an athlete bleeds over and the performance anxiety bleeds over into like more like suicide ideation or like cutting or anything specific on the clinical side, as a mental performance consultant, you would want to write a referral out to either a psychiatrist or a counselor or a psychologist. And then you also have marriage, family counselors in here also. So you want to send that off to somebody higher up. That's where it can get kind of sticky, because I've seen mental performance consultants try to handle situations like that, and I feel like it's very dangerous. Me personally, you got to hand it to somebody that is practicing that or has a training behind. Basically, what I'm trying to say is pretty much practicing your scope. A lot of people are practicing out of scope these days, and that's very dangerous bleed over. And then of course like diagnosis and evaluation, and then holistic self-care. That's pretty much, we all touch on that no matter where you're at in the field. And then mental health counseling, mental skills training. That's when you see more of the consultant side kind of checking off all the boxes at the end, like the referrals, the supportive rehab and energy and pain management, mental health screenings that's checked off, more evidence-based on that. And then and a lot of the mental performance stuff is evidence-based, but it's still new, and it's going to take a minute for it to grow because a lot of it is still brand new. Because there's so much new stuff out there. Like people are coming up with new stuff like every day. I'm on LinkedIn, like, wow, people are doing it. Cool. And this kind of dives into what he asked me on the question, advantages and disadvantages of what I do. Advantage, I do offer holistic athlete care. I can treat clients, again, from suicide ideation all the way to mental skill development. A disadvantage is a stigma. People, they'll see my license and they'll see like who I am, and they'll go, "Oh, he's just a counselor. He doesn't know how to do performance." But they don't know that, like, my experience in West Point has fully equipped me to offer performance advice and performance, resources at a very high level. Like I'm fully trained in performance. I just, got to pass that exam and get that CMPC behind my name. But some people literally will be like, he's a mental health therapist, he doesn't know how to do performance, but that is not necessarily true. With proper education and training, I feel like any of us can do anything in this chat, but just make sure you're practicing in scope. Um, Another advantage is job security. Because right now, like I said, we're in really tricky times right now. Right now, there's a lot of jobs hiring, and they said they want somebody that's a performance specialist, but they also want somebody that's licensed uh, clinically. So it's just trying to. I think it's just very very different, and it's going to take somebody higher up to kind of make a decision to choose what it's supposed to look like and what it's supposed to be. That way, people can not be so confused throughout their college years. Because I was confused too. Literally 2 years ago, I was like, I don't know what I'm doing. I'm just finishing whatever I got to finish, and then we'll see from there. um, but that's why it goes back to what your why is. Like from the first question that we did, what is your why? That's gonna guide you to where you want to be. Disadvantage is training. Everybody's trained differently. I'm friends with a lot of CMPCs, and there's information that they know that I don't know. There's information that I know that they never heard of before. So it would be nice to have like some type of standardized training method. And the biggest emphasis I have for all of y'all is just find good mentorship, because there's some bad mentors out here. I've seen some CMPCs get trained by some bad mentors, and I've seen their work, and it's not effective at all. I will say I was blessed with some really good intern or mentors, Dr. Angel Brutus and Dr. Tyler Bradstreet, some people that have really been pivotal people in my life, and also helped me get those jobs that I told y'all that I had leading into where I'm at right now. So find a good mentor, and the best way to do that, is to just keep showing up to conferences, get to know people, shooting the breeze. Relationship building is so important. A lot of people are starting to open up their services a little bit more. Back in the day, it was a lot of gatekeeping going on, but I don't really see much gatekeeping going on these days, because we all need help. If you're a gatekeeper in this chat, man, I really question you sometimes. I question you, because we all need to be able to share information. And I was always taught growing up, if you truly cared about what you do and truly love the knowledge of what you do, you're gonna share it with somebody. If not, then I don't I don't know. I don't know why you're in the field if you're not gonna share the information. um, and then here's some of my services again. I offer individual and group therapy, and also do performance enhancement. I also do team workshops, and then I also help with this club that we have similar to y'all's club. It's called Athletes Connected, and we created a space of homogeneity, bringing people together from all walks of life, to primarily focus on social media, and also like training mental health awareness, and just bringing people together to formulate groups and create community. Okay, let's switch back, see if you have some more questions.
Yeah, AC, thank you. I'm gonna ask, what are some overall challenges you overcame, and are there still some challenges you hope to overcome?
Challenges in the field or just in general?
Yeah, this is general, so we're getting, a little bit into who AC is here.
Right, right. In general, I will say ageism is real. A big challenge I've faced is like people, questioning who, like the services I can offer, and also my resources because of my age. Because I'm only 26, and then when I was hired at Michigan originally, I was 25. I just turned 25. So ageism is real. Whether you're too old or you're too young, people are gonna, you know, look at you a certain way. So that's a big challenge I faced coming into Michigan. People were like, "Yeah, he doesn't know what he's doing. He's just a young guy." But then, I let my work speak for itself. I've been able to kind of help a lot of athletes and help a lot of groups, and then just let the work speak for itself. And another challenge is also, still being like a Black male working in this space, and there's not that many of us. And so looking for like peer mentor support in that, and also knowing that, anti-racist or racist practices are still very real, even though people, may advocate that they're not. You can feel it and you can see it from the inside. Um, and I guess another challenge too is just bringing athletes, into the space of being comfortable enough to talk about what they're going through. And then that's where I say we come in as a beneficiary, because being young and being in the field, it's just a different connection. Because I remember back in the day, like way back in the day, the psychologist or like the therapist was like the old man with glasses and wore a suit. But now you see like men, women, and just all walks of life stepping into this space and connecting with people on a different level. So I think that's really important, to walk into your space authentically who you are, Like if y'all saw me on campus, sometimes I wear ripped jeans, I'll wear like Jordans, I'll wear like Nike, like just to kind of be casually myself, just let the people know like, hey, like I'm a therapist, and you can come, chop it up with me, whatever. Like it doesn't matter if I'm a professional. Like I am a professional, but it shouldn't matter for me to look a certain way either. So that's a challenge. Also, some people think I should dress a certain way at work, but I'm like, I don't care what y'all think. I'm gonna dress the way I want to dress. You can't fire me for wearing that outfit. But 100%. What else? What else you got?
Yeah. All right. Thank you. So what are your favorite parts and or responsibilities of providing mental health services to others?
My favorite part is just seeing the fruition of everything, like seeing an athlete that actually puts in the work. Um, we always have to hope. That's one thing we always have to remember too. Another thing to take home. Um, we are trained to be experts at what we do, but I hope people will learn over time that we may be the experts at specific things that we do, whether it be consulting or counseling, but we need to be creating people to be experts of their own lives. So there's a lot of pride in what we do, and some people, post on social media like, "Oh, I helped this athlete out become, I helped this athlete win the Heisman, or I was responsible for that as his clinician or as his performance consultant." But I always look at those people like kind of, like, did you really do the work, or did you just guide them to learn emotional intelligence in order to become a better expert for themselves? So if I were, I would look in the mirror personally, and I do it myself all the time. I'm just like, hey, if an athlete does something really well, I was part of the journey, but I don't take credit. You get the credit. You put the work in. I just helped you. Don't look at me as an expert. You're an expert for putting in the work. I was just kind of like the guy that just, helped you in that way. So that I think that's the best part of my job is just having the wisdom and knowledge to instill into people's lives and watching them become like that expert that we think we are sometimes.
Yeah, I believe they call it the 5 finger fever, right? When you get like overly involved and like you try to
Hmm.
take credit for somebody's accomplishments. Yeah, that's a real thing. You can catch it. So it's important to be aware of that and be careful. Thank you. Thank you.
Yeah, for sure. It's a real thing in our field for sure.
Yeah. This is the last question I had. And then we'll open it up for any Q&A.
Okay.
What's something special or unique about your career path that you find interesting to share with others?
Um, Special and unique. I took an untraditional route. Most people will go straight like sport psychology master's, sports psychology PhD, and then work. I took the counseling master's route, did a performance internship, then got hired to work without a PhD, and that's another thing. There'll be jobs that will say like, "Hey, we want a PhD preferred," but I encourage people in this chat to apply for any job. Throw your application out there. Don't matter. It doesn't matter if you have a PhD. It doesn't matter if you don't have the license. I was actually hired over 3 PhDs, and just based off of experience and also kind of like presenting yourself well in interviews, and also having connections. So I feel like it's really important for people to be confident in that area specifically, to be able to apply for jobs that you may not necessarily think you fit in, and then also to just kind of reframe your thinking about how you're doing your work, and also how to grow as a clinician, because constantly there's one point like another thing I was taught too is whenever people get their license, whenever people get their CMPC, it's almost like a breath of fresh air. It's like, oh, I finally did that, but that doesn't mean stop. A lot of people think, oh, I'm an expert now because I got a CMPC, or I'm an expert now just because I got an LPC. You're not an expert. We're just like we teach our athletes to grow continuously. You have to do the same thing as the clinician and as the practitioner. Um, the growth mindset is really important. The trusting mindset is really important. Trusting your abilities, being able to deliver services properly, and I think that's the best thing that has kind of like been instilled in me, and it has allowed me to kind of like be so sporadic and grow in different areas and try out different populations. So
Yeah, that's why I feel like, I really wanted to speak. I wanted everybody to know your route, right? And how you took it, because I thought it was very interesting. And I thought you had a lot to say, and it just showed that you had a lot to say. Thank you so much, AC. What we're gonna do now is we're gonna open it up for any Q&A. If you guys had any questions, feel free to drop it in the chat or unmute yourselves. So we'll take a couple minutes to open that up.
sure. anything in the chat? Okay, cool.
I have a question. So
Whoa.
did you know you had like was Michigan like the right fit for you? I mean, like how did it seem like it was a right fit right off rip, or and how did you even find out about it?
Yeah, I found out about Michigan through LinkedIn and also through a colleague because jobs are just floating around everywhere now. People are just like reposting them. If you follow like Zach Brandon on LinkedIn and also another guy named I think his name like James Stewart, they repost jobs all the time. So I initially saw it, and then I kind of just looked at the the requirements and also the qualifications. And one thing that I love doing is like going into spaces and kind of like leaving a footprint there. And so back in the day, a lot of people don't know that Michigan was like one of the programs that got funded a lot of money to hire a bunch of mental health professionals in order to meet the student athletes' needs. And but the flaw was they hired a bunch of social workers, and they had no like performance specialists on staff. They had no psychologists on staff. It was just all social workers. And so um, I know whenever they posted the job, they put a heavy emphasis that they wanted somebody that was skilled in performance work. And so initially, I was like, I could be that guy. So in the interview process, I heavily emphasized that I'm trained in performance. I work with the Army, and I have all the skills and all the resources. I got PowerPoints ready to go. I got injury support groups ready to go. I got everything ready to go. And that's kind of like how I feel like Michigan was a good fit because they were kind of demanding that. And when I got hired, I went straight into kind of like that population. Specifically, I was doing like a little bit of clinical work, but I was mainly doing like performance enhancement groups and helping people kind of learn like this new culture that was never instilled into Michigan's culture. So I thought it was pretty cool.
Thank you, AC.
For sure.
Are there any other questions, maybe?
I got a question.
Let's hear it.
So I can only imagine like how I don't know if draining is the right word, but just the amount of work can sometimes be a lot. So I'm curious, like, what do you do personally for your self-care and balancing yourself, like as a holistic person?
Yeah, we talked about that earlier. Self-care is really important. I travel a lot, and I try to turn work trips. I try to turn work trips into like little mini vacations. Like when I was at the Ask conference, I went to like Disney and I went to like Orlando. But I think it's really important. So when you talk about self-care, I mentioned it earlier with Daniel. I think it's really important to think about like the Likert scale, like from a scale of 1 to 10, what is your stress tolerance? And and I know some people would say like, oh, my stress tolerance is like maybe about a 7 or 8. And on the back end of that, you need to ask yourself, what is my self care tolerance, or how long, how much am I indulging in self care? If you're indulging in self care is a 3 out of 10, and your stress tolerance is a 7, how are you going to bump that up to get closer to a 7 or even greater? I think about it as like if you work 20 days out of the month and you take 2 days off, do you really think those 2 days are really going to replenish 20 days? So I schedule 1 hour sessions for myself, like writing in my journal. I love journaling. I usually like go to coffee shops, people watch. Um, yeah, literally coffee shops for sure. Yeah, and then sometimes I'll just order like a warm drink and just touch like the warmth of the cup and just sit there and just ground myself. Self care just I don't know. Self care just looks so different. But for me specifically, it's just been kind of just detaching and leaving the baggage at the door, and traveling, and also just being around a social support system that's different. Because I have a lot of colleagues that I work with. They think that I'm their friend, but I was like, y'all are just my colleagues. I have an actual real friend group where I can detach and like not be counselor. You know what I mean? Not be a counselor. So it's important to kind of have that detached moment. So
Thank you. Thank you.
for sure.
I have a question as well, but I just wanted to start off by saying thank you for being here and thank you for sharing all this valuable information with us.
For sure.
Yeah, and my question kind of, you touched on it a bit earlier about like your master's degree being in counseling versus sports psychology. We're going to be, I mean, the handful of us in here in that master's program or undergrad program, but coming out with a Kines sports psych degree, how would that differ from the way that you entered and got your job / the way you practice? What do you think would be different? I mean, this is a theoretical, but yeah.
I think because I did get a minor in kinesiology. I think it's like more so like the exercise science part of it. As counselors, we take a psychopharmacology class. We learn a lot about like pills and like medicine and how it can be, in collaboration with therapy and how it can help and how it can benefit. The only difference I see between like the kines and sports psych and counseling room is just, I think it's just relationship building. Because when I was in my kines field for my minor, they didn't really teach us how to build a relationship with a client. It was just more so how to treat the client, how to get them in and get them out. It didn't talk about how to create a therapeutic alliance, how to work on emotional regulation, how to talk about stress tolerances. So I think if you can establish a therapeutic alliance and create a relationship with that person, like a real deep, meaningful one, on like a level where it's like, hey, I'm here for you. Like I'm your counselor. I'm riding for you. If you sink, I sink. If you're floating, I'm floating. I think that's the most important part to even get anywhere with a client, regardless of what degree you have. You have to start there. So I don't think there's too much of a difference in the training besides just the relationship building. So
Thank you for that. And then I just kind of wanted to like circle back to the way that you mentioned that we are told not to have our clients as friends, but at the same time, like you said, you have to establish that like connectivity to be able to have that honest and open relationship. So I think it's great that you shed some light on that. So thanks.
thank you. For sure. For sure. There's a question in the chat.
Yeah.
There's a lot of positivity and what about are there any difficulties you encounter with your dual training? For sure. Yeah. Yeah, and that kind of goes back to the humility piece and also being humble about what you do, because sometimes I feel like as a counselor, originally being trained as a counselor, you feel like you're an expert in knowing how people think. However, and there's sometimes I will be honest that I may have misdiagnosed or maybe have missed where a client was actually wanting to go in the performance realm and also the sports performance world, just based off of my counseling background. So that is a difficulty I did encounter, was kind of like assuming and trying to jump the gun. I was like, hold on, wait, that's just me uh, assuming that. But in reality, helping people where they're needed as they come in that session and that week is really important. Just meeting people where they are. So taking a step back, meeting people where they are, and also just assessing their needs as they tell you, like right then and there. Like face value is so important. Um, and like I said, the bleed over is so real. Somebody come in one day, I was like, oh, I had a terrible game. Throwing baseball. I threw the baseball like too hard. Now I have the yips. And then one day they come in and it's like, oh, my family member died. So it's like, now is it grief? Is it grief or is it the yips? So it's kind of like assessing that person where they are week by week.
This is gonna be the last question for me, AC. So
Mhm.
you're pretty close to your CMPC, right? You just got the exam.
Yeah, for
So
sure.
does that mean the coursework you took in your master's was pretty, I mean, it was everything, right? It was everything relevant to the CMPC?
Um, I took 3 extra classes on the side. Yeah, most master's degrees you can kind of like take like electives. I had to
Yeah.
take like sports psychology electives on the side to kind of implement it into my master's degree. But yeah, relationship building, ethics, research methods, like all those classes. Yeah, I took all those in my counseling masters. So they're kind of the same. I just can't wait till the day that we see where they blend both of the degrees together, to make it less confusing for everybody. And then that'd be so cool to kind of like graduate with a master's and be able to be dual licensed and dual credential. But I'm telling you, the biggest issue is that these psychologists that go to school for 12 years, they're mad that people like us are getting our masters and making the same amount of money as they do. That's what's happening. They're pissed. I went to school for 12 years and you're making the same amount as me. I went to school for 3 years. So you know.
Well, AC, if there's no any more further questions. Oh, okay, there's actually one in the chat. I'll read that. It's by Lindsay. She says, I was just curious, what percentage of the athletes that you work with are recovering from injury?
Like 80%. Yeah, when I was at West Point, like I was literally trained to work with injured athletes. So I have a lot of resources on that specifically. I run an injury support group every week, Tuesday night, 7 o'clock p.m. and the group focuses on like coping skills and also like return to play, and also just like creating a space for athlete community for that are injured, people that are injured. And we have like 13 athletes that show up a week, 14 athletes that show up a week, so it's pretty good space. So if you ever have any questions about that, you can feel free to reach out.
Yeah, if it's okay with you, maybe, you know, if you can, the attendees drop maybe an email, maybe a LinkedIn, or
Yeah,
yeah, if that's okay with you, AC.
for
And
sure.
also, would you be able to give Sarah the host?
Yeah, for sure.
Yeah. So if there's no more questions, we'll be starting to close out. But before we do, quick club announcement.
Let me switch it over.
So we have a Friendsgiving watch party. Well, AC.
My bad. My bad.
No, you're good. No, you're right. So we have a Friendsgiving watch party on the 30th. So next Thursday, possibly our last event of the semester. There'll be food there, there'll be bingo there. So please come out, socialize with the members, say hello to the board. It'll be on at from 5 to 7:30 in HHS 1205. So please join us. Our possibly our last event. It'll be the Seahawks versus the Cowboys, a watch party. So please join us. But thank you all for coming. And if you haven't followed us already, follow us at SEP Beach Club on Instagram. And thank you for coming. AC, if you don't mind, just stay for a little longer while all the attendees leave. Thank you.
Yeah, I'm gonna drop an email in the chat real quick for
Okay,
those
cool.
that
Yeah.
want.
Thank you so
Yeah.
much. Thank you, everyone.
Okay,
Thank
there we go.
you.
No, thank y'all. Sure.
Hey, good stuff. Hey, see, you have me motivated, man. You want me to? I want to rock like University of Michigan gear, man. Just hearing you.
I appreciate it, man. I appreciate it.
Yeah, good stuff. Hey, Daniel,
Yeah,
good
thank
stuff,
you.
man. Like always. All right, later.
Thank you. Thank you, Brando.
Appreciate it.
All right, can we cut the recording?
Still recording everything.